I'm Dr. Hyun Bae. I'm an orthopedic spinal surgeon practicing in Los Angeles, California. Coflex is a very interesting history. I mean, I can't believe that I was involved in the IDE study back in 2006. That's 12 years ago, and I was fortunate at that time, young in my practice, to be exposed to a technology that probably has changed the way I think about spine and treating spinal pathologies. As you know, Coflex is a non-fusion device. It does provide motion with distraction of the foramen, and I was very surprised that I could use that in my patients that would typically fuse, and that they would have just as good results, if not better. I mean, what's amazing is we've had a lot of patients now that we've had long-term follow-up with, and it's amazing how durable the Coflex is. The patient that I would typically thought that I would have to fuse, honestly, the patient that got randomized over to Coflex, and we have a lot of those patients who are so active, whether they're in their 50s or whether they're in their 70s. We have patients now out 7, 10 years, and it's amazing that it just works. The recovery was so diametrically, different. You had one that was almost like an outpatient procedure, and the other group, and you got to remember, we were doing posterior lateral fusions back then, so these weren't interbodies, and this was kind of before the day of the renaissance of minimally invasive surgery. So those patients, I mean, we were talking a 2 to 4 day hospital stay. Spinal stenosis, most common condition. Okay, I mean, obviously most of them have a clauditory type of pain. They're better in flexion. They have a shopping cart sign. I think that, typically when I see these patients, I'm always looking at, hey, do I need to decompress them? Obviously, I think that's the mainstay of why they get better. And the idea is that after the decompression, you kind of have to go through an algorithm of saying to yourself, does this patient need some type of stability to, I would say, guarantee longevity or to extend longevity? The decompression is what makes the patient better right from the beginning. The idea is that do you need to do something more to basically elongate the results of that decompression? I think the biggest advantage of Coflex is truly efficiency. It really gets to what you're trying to achieve. And typically most of the techniques that we use to make the decompression more durable is we rigidly fixate the spine or refuse the spine. Now that does incur a morbidity cost. And if there was a way where we could just elongate or make the decompression more durable without the morbidity cost, I think that would be a great solution. And I think Coflex presents that solution. But also, if you look at the long-term care of the spine at the adjacent levels, I think by not fusing that segment, you're also not potentiating for the degeneration at the levels above and below. And I do think Coflex is more physiologic than a fusion. If you're trying to maintain foraminal height, you're trying to bring longevity, I think it's just more beneficial if you can do that with a Coflex instead of doing that with a fusion. And I think that's what I explain to the patient. I just tell them, there's a technology that we can place in between the lamina that's minimally invasive. Doesn't really take as much time to do it, but I do think the after effects or the benefits of it, you will feel for a long time.